The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. The coronavirus pandemic began almost 10 months ago, and by now, many of us are feeling what has come to be known as pandemic fatigue. Tonight, we'll talk to a psychologist about what you can do to maintain your mental health. We also marked Maternal Health Awareness Day in January, and we'll talk with a psychiatrist who specializes in mental health for new mothers as we continue to bring coronavirus in focus. I am joined now by Melissa Brown, a clinical psychologist with UPMC Pinnacle Health Psychological Associates. Thanks so much for joining us.
Thank you for having me.
What has the pandemic done to people's mental health from your vantage point?
Well, I think a lot of people are, initially were experiencing anxiety at the beginning of this pandemic just because of not knowing what to expect and what was going to happen. And now we're continuing to see that anxiety, but we're also still seeing some depression and sadness and just really just missing out on those regular activities and just wanting to have life back to normal. And some people are frustrated and angry. So again, a lot of those depression-like symptoms.
Yeah, you can certainly understand that. Are you seeing new clients with this or some of the people you've seen in the past?
Our practice is continuing to see new people on a regular basis, on a daily basis. I think that we are as busy as we have ever been in my in this practice, and certainly our my colleagues are staying busy and having full caseloads. So thankfully, people are reaching out and seeking those services to find support during this difficult time.
Yeah, well, we'll talk more about that as we go along, but we're social beings, I guess, by nature. So is that part of the problem, just being isolated from other human beings, even, the touch, the eye-to-eye contact?
You nailed it, Susan. It is really, we miss out on those connections that we are used to. We are social creatures, and most people enjoy hugs and high fives and those smiles that just are gentle reminders of a simple hello, and being able to get together for weddings and birthday parties and other celebrations that have been done differently, and people certainly have gotten creative with the electronic connections, but it really is not the same of that in-person camaraderie that happens when we are able to get together.
Well, even all of that electronic stuff, doing everything virtually, that can certainly have an impact, especially I'm thinking, on students and parents having to deal with it.
Yeah, we often hear the phrase, I'm zoomed out, and I'm, certainly, the physical impact that it has on our systems, but again, connecting to that mental impact of not being able to see this person or these people or get together with your classmates in person really does, take a toll on people and kids in particular, and adults as well, just wanting to have a sense of normalcy of hanging out and especially, with other events that we are circle our lives around social events, and so we really are being pulled away from that, and the electronic media just isn't the same. It's not the same as being in person.
Yeah, we've all missed so many life events, graduations, some weddings having to be canceled, that kind of thing. So it certainly has an impact. Do you see this as having a long-term impact, or do you think once we go back to a more normal lifestyle, it will just get better?
That's a great question, and I get asked that question a lot. I certainly see that this can be very impacting on certain individuals long term. And we all know those very resilient people in our lives that, their house roofs could blow off and they're just like, oh, it's fine. And other people really that they struggle with that. So some people will impact long term, and that it will be important for them to seek mental health treatment and supports in other ways. And I can definitely see the increase in anxiety for people surrounding the unknown, and just trying to stay healthy and follow those rules, and but also the struggle of integrating into the daily life of going to the grocery store and being in person again, and certainly that can be stressful for people in the future too, when we are, all of these social distancing rules are lifted.
All right, well, stay with us, Melissa. We'll talk more about how you may discover you may need help and what you can do to get that help.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation with Melissa Brown, a clinical psychologist with UPMC Pinnacle. Again, thanks for being here. So you mentioned resiliency. Why do you think some people are more resilient than others?
Yeah, that is the question research has been trying to figure out. And, some people just naturally are, if they've gone through a lot in their life, we're able to be successful in navigating those difficult experiences. That often helps people be more resilient when there are troubling events that do happen. And so that's one reason some people are more resilient. Some people have great, amazing support systems. Some people rely on their faith or their spirituality. And, again, there's so many different factors that play into that. And, in making sure that, resiliency is certainly something that comes over time, but and making sure you're delegating what your needs are to those that can support you and assist you.
How do you know if you need help and you should reach out to a professional?
So one of the biggest indicators is there any significant change in how you're functioning? Were you usually an up with the birds type of person and had a good exercise regimen and followed a nice routine, and now all of a sudden you have no routine, you're not exercising, and you're sleeping or want to sleep all the time? Those are just some good indicators, and any significant change from your personality and just who you generally are is one of those first indicators that you might want to start seeking professional help. And of course, the other big red flag is if you feel like you want to harm yourself or anybody else, and that's absolutely immediately call someone and try to get, ASAP support and connection, to talk through those feelings and those thoughts. And oftentimes we don't like to talk about our mental health needs, and we look at it as something that we talk about in secret, but it is important to make sure you're talking to other people and trying to find out what you're feeling. Is that normal or typical? But again, any changes in your appetite, your eating, your personality, those are all big red flags.
I know early on in this, we were telling people, or the experts were telling people, develop some kind of routine, even though your normal routine may be upended.
Absolutely. That is one of the best things to help you feel structured and in control. And that helps reduce our anxiety. It also helps our brain just kind of know what is going to happen next. And it just helps relieve some of that stress. But if you are out of routine, it's easy to get back into it. Get up around the same time every day. Go to bed around the same time every day. Eat your scheduled meals and those scheduled snacks. And of course, get some exercise. I'm a big proponent of getting outside for 5 minutes every day or so. We need that vitamin D and we need to soak it up, especially on those real sunny days right now.
Yeah, absolutely. I love doing that. What can people do? Where can they get help through this pandemic if they're still, staying home, not going out?
My office, UPMC Pinnacle Health Psychological Associates, we are still accepting new patients, and we are doing those sessions virtually and in person. Everybody's a little different with what their needs are, and I have some patients who are doing a combination of both depending on schedules and what they look like, and so our office is certainly a place that you can call.
How does that work? I mean, does that go okay, doing the virtual sessions with folks?
Well, I know a lot, myself and my colleagues, it certainly was an adjustment to do the telemedicine. And, we're used to seeing people in person, and really using our senses and skills that we've been trained to assess people. Those simple things that you just kind of, how is this person really doing right now, and are they a little more sad than usual? But so we had to adjust our skills and skill sets, and after a month or so, I think we all fell into a nice rhythm and developed some new ways of assessing people virtually. And some people it works really great for, whether it's a schedule issue or they have other children at home or what have you. But and other people, it's not the best connection, and that's okay. And certainly we can see people in person, and I know most of us do prefer in person, but
Yeah.
we will work virtually if necessary.
Well, again, that eye-to-eye contact and really seeing someone up close in person. And just quickly, Melissa, what about the stigma? Mental health, as you mentioned earlier, still does have a stigma.
Unfortunately, it does. And I always use the adage, we don't talk to people about our mental health. If you're at a picnic, you're not asking, how are your psychology appointments going? But you're okay asking someone, how did that heart surgery go? And it's really interesting that, we still have that stigma that still exists, and people feel a sense of weakness, that they should just be able to pull themselves up by their bootstraps and get over this depression or get over this anxiety. And we would not say that to someone who has a heart condition or diabetes.
Right.
Just figure it out.
Just get over it. Yeah.
Yeah.
All right. Well,
So,
thank you.
and you're welcome.
I'm sorry, I didn't mean to interrupt you there. Did you want to add
Okay.
something?
Oh, I was just going to say, there's no shame in asking for help.
Absolutely. Good point to end on. Thank you so much for joining us. We appreciate it. And coming up, we'll talk with a doctor about maternal mental health and how the pandemic is affecting new mothers.
This is WGAL 8 in Focus. Coverage you can count on.
I am joined now by Dr. Nazanin Silver, a gynecological psychiatrist with UPMC, Pinnacle Women's Behavior Specialist. Thanks so much for joining us.
Thank you for having me.
This month marked Maternal Health Awareness Day. Tell me why we have that and what that is.
Well, Maternal Health Awareness Day is very important to myself and my colleagues due to the fact that over the last 2 decades, we've noticed a trend in increase in maternal deaths in the United States. And that has not been happening in other countries. Hence, we have been paying more attention to maternal health and well-being. Maternal health includes both physical and mental health. And again, it speaks to the well-being of a mom.
What are these deaths normally from? Is there a trend there?
Well, that's what we're trying to figure out. Most of the states have a committee called the Maternal Mortality Review Committee, looking at why these trends have been increasing, specifically in the United States, instead of decreasing. Some of the things we've been looking at are mental health related issues, such as depression, anxiety, and suicide. Those are important things that often are overlooked.
Why do these mental health issues hit new mothers?
Pregnancy is a very vulnerable state in general. I don't think most people understand or are aware of that. Women are expected to, bear children and for it to be a fine and happy time period in life. But what people forget are the immense number of changes. And I'm not talking just physical changes. I'm talking about emotional and mental health changes that can occur in a woman, both in pregnancy and up to 1 year postpartum. There's a lot of dysregulation in the brain that could occur, leading to significant depression and anxiety. There's a normal level of worry when you get pregnant, but when it becomes a clinical problem, that's when we start to intervene and try to help our patients.
And how do you know if it crosses that line, if it gets to that clinical level?
So some of the signs and symptoms of depression and or anxiety are just in a lack of interest in daily activities, low motivation, tearfulness, feeling sad, being uninterested, having appetite changes, problems with sleep, as well as significant worry that seems excessive or irrational, racing thoughts. So, all of those things combined can be overwhelming to the body. And when those things persist most of each day, and last greater than half the week, that's when you should start seeking a healthcare professional to see if this is actually a clinical problem that may persist and intervention will be needed.
We hear the term postpartum depression. Is that what you're talking about, or is this something even more?
So I would actually encompass it as the perinatal time period. Perinatal meaning from the point of conception all the way to 1 year postpartum. So that's almost 2 full years. That time
Wow.
period is a very critical time period. Depression and anxiety can occur in the first trimester, second trimester, third trimester, and immediately postpartum up to 1 year. The most critical time periods in pregnancy are the third trimester as well as the postpartum period.
Boy, that's a long period of time, I'll say. Wow, it's something we don't think of. You mentioned changes in the brain. Is this a lot, I imagine, has a lot to do with hormones and hormonal changes?
So we don't quite understand exactly what happens in the brain. We do believe hormones may contribute to it. Again, I can't speak as to the exact mechanism, but there's a dysregulation in a regulatory center of the brain that will impact mood and anxiety levels.
Wow. All right. Well, stay with us, Dr. Silver. We'll talk more about some of those signs and how people can recognize them and what you can do about it.
This is WGAL 8 in Focus. Coverage you can count on.
We continue our conversation with Dr. Nazanin Silver, a gynecological psychiatrist with UPMC Pinnacle. Again, thanks for being here. We've been talking about maternal health and maternal health awareness. We talked about the depression and other symptoms. What would you say to people who may be partnering with the mother or family members? What should they look for in terms of signs?
So I think it's really important to pay attention to your partner, family member, and see what behaviors may have changed in them. Like I said, oftentimes people will just withdraw, patients will withdraw, they are not interested in taking care of themselves, and hence the pregnancy. Oftentimes just normal level motivations are decreased, interest in daily activities, mood fluctuations, irritability. Some people have sleep problems. Some people sleep a little too much some people sleep too little. And just a lot of anxiety and irrational worry. If those signs and symptoms start to persist and they start to last more than 2 weeks, I would certainly encourage going to either the OB/GYN provider or the primary care provider to discuss the symptoms and potentially be screened for any mental health disorder. Unfortunately, there's a huge stigma in society with regards to mental health. Oftentimes you hear people saying, oh, it's just in your brain, snap out of it. Well, that's really incorrect. It's not just in the brain. And if a patient could quote unquote snap out of it, they wouldn't be experiencing anxiety and or depression. I think it's important also for people to understand that being pregnant and having a child is a very, very important and overwhelming experience, whether it's a first-time mom, a second-time mom, or a mom with her 5th child. There's always a change in the body and in the family dynamic. And I want to reiterate that without a healthy mother, there is no healthy child and no healthy family dynamic. So the attention needs to be focused on the mom.
Yeah, it can be overwhelming, that's for sure. I imagine some women might feel reluctant to ask for help. They might feel like a failure as a mother and as a woman.
That's very, very true. And that's where we want to educate the public to let them know that this depression is actually the #1 complication of childbirth.
Wow.
It's not bleeding, it's not hemorrhage, it is depression. Anywhere from 10 to 20% of women experience depression. And depression can be debilitating, and it is a real thing. It's a period of hopelessness. There's different degrees of depression, from mild, moderate to severe, and what we want to prevent is the depression from becoming moderate to severe, because then there's catastrophic consequences that can come from that. Things like psychosis or a vegetative state, and suicide, as well as infanticide. These are real issues. And, once a mother delivers a baby, she's told that this should be, just be happy. This is a glorious time period. Well, it's really not. You're not sleeping. Yes, you have a lovely baby. You're not sleeping. You're struggling with adjusting. You may or may not have a supportive partner. And some people struggle to breastfeed, and they're guilted into breastfeeding. And so all of these topics need to be discussed, and patients need to be educated. As far as
And what do you find are some of the best treatments?
So some of the best treatments really are, could be a combination of medication and therapy together. Really depends on the individual case. Some cases, if they're mild, therapy can certainly help. Other cases, when you get to moderate to severe depression, especially if the individual also has a history of it or has risk factors for it, then medication and therapy are going to be the intervention. And I want to reiterate that a lot of the medicines we have today, most of them are safe in pregnancy.
Well, that's good news. Well, and I'm certain we don't have a lot of time left, but the pandemic has certainly exacerbated this whole situation for mothers who may also be isolated.
Yes, absolutely. It has. We've seen a significant increase in mental health disorders, including depression and anxiety, in the entire population, including in pregnancy and postpartum. And that is the field I specialize in. As a former OB-GYN and now a women's behavioral health psychiatrist, we've certainly seen these numbers increase.
Well, Dr. Silver, thank you so much for being here and sharing your thoughts on this very important topic, and one I think that gets overlooked a lot.
Thank you so much for having me.
Thank you for joining us for WGAL 8 in Focus. For all of us at WGAL, I'm Susan Shapiro, and join us again next Saturday at 7 o'clock for WGAL 8 in Focus, right after NBC Nightly News.